Good evening. I see that our room is starting to get filled up with club members. So we're going to give it just a couple more minutes for our members and participants to join us. But thanks for being here, and hang on just a couple more minutes here. All right, well, let's go ahead and get started. So I want to welcome you all and club members who have joined. Thanks for taking some time this evening. Edgar and Dr. Hansel, we are really honored to have you here this evening. And for our club members, it has been my privilege over the past year to be a part of the OHSU Gift Planning Council, and it's part of the OHSU Foundation. And every time we get together, the foundation brings to the participants of the council a physician and something really cool going on at OHSU. And those of us who live in Oregon and Portland and the surrounding area, we know that there's a lot of cool stuff going on at OHSU, and it's great to kind of get eyes and ears on some specific things, particularly as it pertains to COVID, where we are right now in Oregon, the US, and the world. And so I'm going to stop talking. I'm going to introduce Edgar Gonzalez, who is a part of the OHSU Foundation, one of the development officers there, and he is going to introduce to us the doctor. So thank you all for joining us. Dr. Hansel and Edgar, thanks for being here, part of the University Club of Portland. Part of our mission is to provide education to our members, and you're going to get to do that this evening. So thank you.
Oh, it's our pleasure. Thank you so much. We're grateful to be invited to present to all of you. I'll be really brief. I'll just do a little housekeeping and introduce Dr. Hansel. I've lived in Portland for about 12 months. I joined the foundation just about this time last year, and 8 out of those 12 months, or 9 of them, have been spent mostly inside my house. And of course, that's because of COVID and the pandemic. So that's why tonight we have the pleasure of joining you. And I have the honor of introducing Dr. Hansel, and she's going to give you her CV and a lot of her, I suppose, quantitative introduction. I'll give you a little bit more of a qualitative and personal introduction. Dr. Hansel, of course, is the Chair of Pathology and Laboratory Medicine at OHSU, but she has been the strongest leader and driver for OHSU's response to COVID. She has been all over this town and all over this state, advising and actually individually testing people herself, and building the capacity for OHSU to do this work in a really meaningful way across the state of Oregon. And she'll tell you more about this, but they are up to doing 1,500 or more tests per day in the lab. And she has been working around the clock, and it's a real treat to actually have her sitting at her house and giving us some of her time. So just really quick before she starts, if you have questions, please put them in the chat. And there's a chat function in Zoom. And if you have, unfortunately, we can't unmute and talk over each other. So if you put questions in the chat, I'll be monitoring the chat and I'll be asking the questions of Dr. Hansel. But other than that, Dr. Hansel, take it away.
Thank you so much. I really just wanted to take a minute to thank Alan and Shelley and the University Club for the opportunity to present here tonight. I'm sorry we can't meet in person, but I am really excited to meet all of you by Zoom. As Edgar mentioned, my name is Donna Hansel, and I'm Chair of Pathology and Laboratory Medicine at OHSU. Similar to Edgar, I haven't been here that long. I've been here, I think it's about 18 months. And again, a large part of that, about 9 months or so, has been during COVID. So with that, I did want to share with you my experience and our experience at OHSU with COVID-19 and how the virus has really changed how we operate in my Department of Pathology and Laboratory Medicine, both now with the efforts that we're doing as well as in the future. I thought a little bit about how to start off today, and I know that since I haven't had a chance to meet many of you before, I thought I would share a little bit about my training and background. And to begin with, I guess I'll start back with my undergraduate training. I did a Bachelor's of Arts in biology. It's always strange, it's called Bachelor of Arts, even though it's biology, at the Johns Hopkins University. And I stayed on there in the medical scientist training program, which is an MD PhD program. So you get both degrees. And while I was there, I completed my PhD in neurosciences. And my thesis at the time focused on how some nerves in the body can regenerate. And I spent a lot of time correlating those sorts of findings to human disease. And that really sparked my interest in the field of pathology. I followed up my MD and PhD training with postdoctoral studies in genetics and cancer biology. And to do that, I did a joint fellowship going between Johns Hopkins and Erasmus University in the Netherlands. It was really a wonderful experience. I finished up and I completed my residency and fellowship in pathology at Johns Hopkins. And I had a subspecialty focus in pathology, and especially prostate and bladder cancer pathology. So pretty different from the COVID field we're in today, but it really helped pave the foundation for where we are here. After I finished all of that training, I think one time I added it up, and I think it was about 16 years altogether, starting with college. So quite a long time. I moved to have faculty positions at the Cleveland Clinic in Cleveland, Ohio, and at the University of California in San Diego, where I was division chief of anatomic pathology. And that's the part of pathology that deals with tissue slides and biopsy diagnoses. And we could talk more about that later if you're interested. But I did want to transition a little bit to how I came to be at OHSU. So back in, I think it was late 2018, I was approached by OHSU to consider the role of Chair of Pathology and Laboratory Medicine. And to me, the position was really exciting because OHSU is the only academic medical center in the state. And remember, before coming here, I was in San Diego, where there are a lot of hospitals and a lot of academic centers that are down there. And what really appealed to me with the OHSU opportunity to move into the chair role was that OHSU's mission is really to help Oregon residents, Oregonians, by providing the best medical care and serving as a center for medical research and innovation in the state. So being able to develop programs that could really help a lot of people and a really diverse set of people was especially appealing to me. And I accepted the position, and I began here last year at the beginning of April. So when I got here, there were a number of challenges, but I would say one of the major challenges that existed in the department was a historical lack of a microbiology laboratory section in my department. So typically microbiology laboratories are based out of pathology, and these are one of the basic kind of biology sections that we train our residents in. And it was really a problem for OHSU. You know, for many decades, these tests were being outsourced to commercial labs, and there's a lot of benefits to having testing in-house, and not just the training I mentioned, but also patient care. Can you develop tests? Can you do those quickly? Can you be nimble in the face of an outbreak? And so, you know, it was really a problem that we didn't have a microbiology lab. And in fact, we're really one of the only academic medical centers in the US that didn't have this type of lab section in pathology. And so it was clear that we needed to build out this program, and we needed to build it out to support strong research that was already happening in virology and bacterial research and fungal disease and parasites and human immunology and the response to infection that was already happening at the institution. And I'll say this, the rebuilding of the microbiology laboratory had been talked about for quite some time, for decades really. And there were efforts to rebuild microbiology over the past several years, but it always seemed to be a challenge to obtain adequate funding. And the funding that we needed was to build out the infrastructure, equip the lab, and hire new staff. And so back last summer, summer of 2019, new chair, I was determined I'm going to come in and I am going to take care of this. So I organized a group of senior leaders from OHSU to figure out what we needed to do to build out the microbiology lab. And we talked about the fact that there were a lot of infectious diseases that were becoming more difficult to treat, and that we needed to couple diagnostics with cutting edge research and clinical trials to address the gap. And we also talked about, and I'm not just saying this in retrospect, we also talked about the fact that pandemics were emerging more frequently. We even talked about what we thought the next pandemic would be. And it's really interesting to look back now. There are times I wish, sometimes you just weren't right, but here we are. And, we didn't just talk about viruses and viral pandemics. There was really a much broader concern that we talked about in the space of infectious diseases. So we talked about the scope and type of infectious pathogens, and by pathogens, I mean, in the broad sense, viruses, bacteria, parasites, fungus. These were really increasing rapidly, and our ability to successfully defeat these pathogens was just not keeping pace in the US or globally. And the long-term risk to human health is really high. It's been estimated that by the year 2050, infectious diseases will kill more people in the United States than cancer. And if you think about that, that's really profound given the level of the medical care that we have in this country. And, thinking back, we've seen some of the implications that we discussed already with SARS-CoV-2 or COVID-19. SARS-CoV-2 is the virus that causes COVID-19. But I think we also probably all know someone who has had, a really bad experience or a long-term disease course with an infection. So diseases like Clostridium difficile or C. diff, chronic staph skin infections that don't respond to antibiotics, urinary tract infections that keep coming back, some infections you get from being in the hospital, and they're called hospital-acquired infections, and it's a real problem. And in addition to those, there are common diseases that we experience, but in which we haven't made major advances in eliminating. So I'm thinking even of the common cold coronaviruses, rhinoviruses, the flu. We had the flu pandemic in 1918, and we still have hundreds of thousands of people die every year from the flu. So there's a long way that I think we can go to make a difference. And so, going back to last year, knowing how important diagnostics are in the setting of infectious diseases, we worked really hard to identify space for a new microbiology lab at OHSU. And we realized that only when this basic laboratory function was in place could we really bring together the research strengths at the institution to do the clinical trials that we talked about, to do the research focused on human samples, to develop cutting-edge diagnostic testing that could detect diseases early. We could also do things like track diseases over time and determine the molecular and biological mechanisms that could be used to treat these diseases. And so thinking about all of this, we found new space for the clinical and research microbiology activities. We applied for grant funding to support infrastructure needs, and we continued working on our plan to recruit a microbiology lab director and expand the services that we have on campus. And that being said, with all that progress, there still remain ongoing financial challenges around hospital funding, and we were still working through these at the end of 2019 to see if we could even build out the space to complete the first part of our vision. So then 2020 came and COVID-19 happened. And, you know, that was the scenario I was really the most worried about, in the absence of a microbiology laboratory. And I'll share with you my personal experience from this night. I know Alan has probably heard this before, but I remember when I got the text message about COVID-19. And that was the night that my family and I met some friends downtown. We were out at dinner. We were on our way to see the Harry Potter musical. So February 28th. And we were in the middle of dinner, and I received a text message from the Lake Oswego School District that shared that an employee of the Forest Hills Elementary School had tested positive for COVID-19. So my children are not in the Forest Hills Elementary School, but they're in a different elementary school in the Lake Oswego School District. And the threat was real. It was in our neighborhood. And so right in the middle of dinner, I put my fork down. I texted our head of the infectious disease service, and he was also hearing the information at a news briefing, right concurrently at the same time. And this really changed how we thought about learning about the virus in the news. Everything was coming out in this real-time fashion. And we were trying to keep up with where the virus was, what was happening, what the restrictions were, what the testing was going to be, what's the CDC saying, what have you heard? And it was just happening at such a fast pace. And, you know, from my perspective, our goal is to really make sure that we had the testing available that we needed, both for our patients, but also for Oregonians, right? This is why I came here. And, you know, part of this too is trying to predict what was going to happen and how much testing we needed. So I'm not sure how Harry Potter went. I didn't really see much of it. I ended up stepping out to make a lot of phone calls. I had to cancel a trip to one of our big annual meetings the next day. You know, I spent over an hour on the phone with hospital leadership and administration, in the hallway of the Children's Theater on the phone. And, you know, finally late at night, Dr. Guang Fan, who's my associate clinical lab director, and I, you know, got on the phone together and figured out what we were going to do. And we decided that, yeah, we didn't have a microbiology lab. We didn't have a microbiology director. Dr. Fan was actually stepping in as an interim while we had launched a search. But we were planning to set up COVID-19 testing, and even if we had to do it from scratch. And so needless to say, the next several weeks were really busy. Dr. Fan and I looked at all the testing options that were available. Every place during that time was scrambling. I don't know if you recall, but there was a lot of discussion, you know, where are the CDC kits? You know, how many kits are they? Why aren't they sending out the kits? Are the kits working? Is there something wrong with the kits? And so it was a little bit of chaos that was going on. Manufacturers, everyone was calling the big commercial labs and the manufacturers, and we're like, okay, do you have COVID tests that are ready? But everyone was scrambling. And we could talk about that later, why we weren't more prepared. But, you know, already at that point, you know, Dr. Fan and I looked at each other and we're like, there's no way people are going to be able to keep up with what's going on. And our supply chain, you could look ahead to see that there would be supply chain issues that would continue to be stressed in the laboratory space as the virus continued to spread. And from our perspective, we felt pretty confident that we knew that things would get worse and that the demand for testing would continue to increase, and without the supplies to meet this demand. And we noticed already that there were back orders on some of the key equipment already in early March. Everyone was becoming more anxious. And we realized that if we were going to do our part as the only academic medical center in the state, we really needed to bring up the testing ourselves and do it fast. So over a very short time period, we worked with the Oregon Health Authority and the Vaccine and Gene Therapy Institute at OHSU to develop our own in-house PCR. And PCR stands for polymerase chain reaction test for COVID-19 or the SARS-CoV-2 virus. And the test that we use and still use, this is the workhorse of COVID testing, is the nasopharyngeal swab. For those of you who have had it, you know what I'm talking about, but it's a very deep nose swab that you get. It's uncomfortable. I've had it once. I never want it again. And so we started working to build these kits from scratch. And, you know, we approached senior leadership to get new support for a brand new lab facility. We said, hey, we have to build a lab. We have to build it now. And, you know, we asked all of the research staff who had the skills we needed to run this test in the laboratory to come and volunteer. And we also asked all of our research colleagues to donate equipment, reagents, supplies we thought we were going to need. And I remember the second day, I went over to my own research laboratory and told my technician, you know, we're going to send this testing hood and this testing hood and this centrifuge and all of these pipette men over to the lab. So it really was a from scratch effort. And I'll tell you, the response at OHSU was just incredible. I mean, it's so inspiring to think back and reflect on what an incredibly stressful time it is, but you know, how much it brought everyone together to work for this common purpose. And so, you know, thinking back, you know, it took, from the time I approached senior leadership, it took 24 hours to be assigned 2,200 square feet of laboratory space. And that usually takes months to do. So within 24 hours, we had space. The facilities team at OHSU, which they're incredible, they built it out within 3 days. We had faculty from the Vaccine and Gene Therapy Institute, especially Dr. Dan Streblo, who I wanted to highlight, who came over to work with me and Dr. Fan in the laboratory, and we got testing up and running. When I say a lot of people volunteered and I was inspired, over 800 people volunteered. The first 2 days, over 800 people volunteered to help the testing. And we were able to beg and borrow and steal to get the equipment we needed to equip the lab in 2 weeks. So by the time late March came, so this was from the end of February 28th, you know, into late March, the lab was up and running. And at that point, we were able to insource all of our COVID-19 testing needs. And this doesn't sound like a lot now, but back in March, it was a lot. We were doing 250 tests a day and turning the results around within 24 to 48 hours. We were all running on adrenaline, I think. And it's remarkable because at the same time, just what we thought was going to happen, the need for testing was skyrocketing and commercial labs were starting to experience delays and returning results in maybe 5 days, 7 days. You know, and you may remember that time. You know, people were like, well, I'm going to be over COVID before I get my test result. And so, you know, I think our ability to stand up this lab made a huge difference, not only for patients, but for others in the community who needed testing. And I'll tell you, philanthropy played a huge role in allowing us to continuously expand the testing we offered. There was an OHSU COVID response fund, and that raised over $12 million, which helped us, you know, continue to hire staff, purchase equipment, and buy test reagents. And, you know, I'll tell you, it seems like years ago that we set up the lab when I think back, but it's only been 9 months. And I'll tell you, I think it was really everyone working together for a common goal that made this all work. It just seemed like everything came together in the right way. And I'll give you an update. I think Alan probably hasn't heard since, you know, maybe the first time we've talked, but we've moved into new and larger space. And I'm going to share some pictures with you in a little bit. And we're now in a new 6,000 square foot laboratory that's a lot closer to the hospital. It's fitted with cutting edge equipment, and we can handle hundreds and hundreds of specimens at a time. So right now we run 2 full shifts and we have capacity to do up to 3,000 tests a day. The bottleneck that we're actually seeing, because our actual test numbers are around 1,600 tests a day, has been in getting people to, get out there and be able to take the samples so that we could run them in the lab. But no longer is the laboratory piece at all any kind of bottleneck. And I'll share with you that if we add additional staffing, including a third shift, we have capacity to get up to 10,000 tests a day. And to me, that I'm really proud of the team. And I'll tell you, with the 1,600 tests we're doing now every day, most of the tests are still reported in less than 24 hours. So not only have we scaled up the testing, but we've gotten a lot faster. And so I'll say, I think we're one of the largest testing centers in the state. And as part of, in some ways, the blessing we have to have this capacity is that we've been able to be a low barrier testing for the community. And in support of the community-based efforts, and I'll show some pictures too, we have just completed validation of saliva testing. So this is different from that deep nose swab. Here you spit into a special kind of tube. And we worked really hard to optimize this test for our community partners who have specifically asked for saliva testing. And our early data suggests it probably works as well as that deep nose swab. So of course I said this at one of the hospital meetings, and the chat box lit up with, hey, can we have this in occupational health? And I'm like, wait, we're starting with the community first. And I'm sure for any of you who have had an NP swab, that sounds like pretty good news if you can have that alternative. I'll also share with you that we've worked to develop a very special kind of antibody test that can measure the amount of antibody and also determine which type of antibody is present. So you may have heard about IgM, IgG. The test we have also measures IgA, which we think is actually important for this virus because of the GI exposure and the respiratory tract exposure. So IgA is very important in that, and this is one of the first tests of its kind. And even though right now, and we can talk about antibody tests more in the Q&A, but right now we're really thinking that these antibody tests will be especially important once vaccines roll out, and especially to determine if someone's responded to the vaccine and how long their antibodies last. So to conclude kind of this reflection and this first part of what I wanted to share with you today, I just wanted to say, I think our success in being at the forefront of COVID-19 testing in the state is really a testament to our teamwork, the collaboration, knowing that we're here to help diverse citizens within the state of Oregon. And I keep saying it's been about doing the right thing and being there to help others. And I think that's why it came together the way it did, because everyone wanted to help. And I think we couldn't have done it without the community, without the foundation. And, I know Edgar's on the call, and I wanted to recognize him and all of his support for that. But, being mindful of all of this, we've really, like I said, I feel it's a blessing that we can give back. And we're looking at ways that we could do this for our community. And, one of the, so we've done a few things at OHSU. So one thing we've done is to develop a really large structured committee that takes a look at requests for testing from community entities, education, higher learning entities, research studies, emerging clinical needs within the state. So we've been working with OHA and together with OHSU to be able to buy, I don't know if this is public yet or not, but to be able to buy 3 vans that are equipped to properly store laboratory specimens to travel around the state where testing is needed. And I'm really excited about this because I spent a long time talking about this with our CEO, Dr. John Hunter, and how we wanted to take OHSU's capacity to help and really get it out to people in the state who don't just live in the Portland metro area. And so we're really excited about this. We just found out last week. And another example I wanted to share with you is a study that I started together with Self Enhancement Inc. to take a look at COVID testing in Northeast Portland and provide more access to testing. And again, this was founded through the foundation. And so we launched the study late yesterday afternoon at Prescott Elementary School. And Thursday, we're going to be out at Imago Day East Side in Northeast Portland. And the goal of the study is to look at sewage signals for COVID-19, which you've probably heard about in the news, but to really think about how we can use this in a metro setting, a smaller population density areas within a metro setting, and how we can compare the frequency of positive tests in the community to what we're finding in the sewage. And to me, what's the most exciting about this isn't that we're doing a study, but it's that the funding is able to help us get testing to where it's most needed and where it's not been available. And, to me, that's really what we're here to do. And so we're going to be out twice a week for 10 weeks and maybe longer if we can raise additional funds. We're, both SEI and our team are trying to figure out what we can do because, it's all about how much testing we could do and, that costs money. But, our goal is really to offer free COVID-19 saliva or MP swabs to symptomatic persons in the community, no matter whether they participate in the study or not. So I'll tell you, yesterday it was so exciting to be out there meeting community members and, meeting people who came up for testing and the teachers who are at Prescott Elementary. And I'll have to say, as a pathologist, I don't often do many procedures, but it just made me reconnect so much with my training in medicine and what that was about. And so I was going to take a brief change in format to share with you a few slides about the lab team, and our community work I just told you about. And then I wanted to use that slide format to also share with you, more of the nuts and bolts about SARS-CoV-2 and COVID-19, just to provide that information. And then I'll exit out of that and come back to share my last thoughts with you about what I think we need to do to get ahead of this sort of situation in the future, including what I think we need to build at OHSU to do that. And so let me go ahead and share my screen. And so I'm so excited. I look back and I laugh because this is really quite some time ago, it seems. And so what we have here, this is when we were first starting the laboratory, March 16th. We received our very first PCR instrument, and that's the machine that does the tests. And we were still waiting for our IT team to finish the build out. And so we were doing a pretty old school method of tracking results. I wanted to share, this is Dr. John Hunter and Dr. Danny Jacobs, who have been so supportive of this effort. This is Dr. Guang Fan, my Associate Clinical Lab Director, who helped me build the program, as well as Dr. Dan Streblo. This is also Dr. Alec Hirsch from the Vaccine and Gene Therapy Institute, and Dr. Mick Scanlon, who is my Clinical Lab Director. And so here we are, we're stacking up supplies. This was the first lab that we had. You could tell it's pretty dated, probably, this was before the mask mandate came into effect. So I just wanted to put that into perspective. But pretty soon we were all masked up. And this is our new lab. So just to show you what a difference the foundation has made. So this is our extraction hood. Here the techs are handling all the real specimens from patients and extracting them, and then it goes over to the PCR area and through our accessioning. And I guess I should move this out of the way. So this is me learning how to do MP swabs, which I haven't done in a very, very long time. And here we are out in the community. This is Prescott Elementary School, and here's Anthony Deloney, who's heading up the SCI Self-Enhancement Inc. piece of it. And here Anthony's showing us how to use the spit tube, the special spit tube that we're using for this testing. And so since we had this slide format, I figured this was the best way to share with you some of the, the nuts and bolts of what COVID is. And so it's actually a member of this family called nidoviruses, and it's, you could follow the tree down, and it's a beta coronavirus, so very closely related to the SARS and MERS outbreaks that we had. And like many of these new viruses that emerge, these are often, they're called zoonotic, meaning that they spread from animals. The bat is a big offender and carries a lot of these viruses, but we know that they're intermediate hosts. And it seems to be that the pangolin, which is shown here, was an intermediate host that allowed the jump over to humans. Now, I had to Google what a pangolin is when this first came out in the news. I'm like, I've never heard of that. But this is what it looks like if you've never had a chance to Google it. I just wanted to share with you, because we're talking about this little tiny space, right, of nidoviruses, the coronaviruses. You don't need to know anything about viruses to see what's happening here. And this is how long it takes for the emergence of a new coronavirus to happen. So a long time ago, it took 500 to 800 years, 200, 300, 120, then 25 years, then 16, then 7, then 2, and then 5 months. And you can see this acceleration of new virus generation that's happening. And this is just in this little nidovirus family. Imagine all the other viruses out there. So this is pretty alarming. And we could talk later about causes, but it's really the contact between human and animals and some of the changes that are happening where people live that's prompting this. And so coronavirus is a single-stranded RNA virus, so it uses RNA instead of DNA, and it has what are called these spike proteins, so these little purple dots here, and on electron microscopy you see it. So it makes this little halo like it looks like the sun, and that's where the name comes from. And it uses these spikes to bind the cells. And as it binds the cells, and we know it can also bind blood vessels, so it's kind of a little bit of a weird virus. It can cause a lot of different symptoms. And I think that's been one of the challenges, is trying to understand, what it's doing and why it's doing so many different things to the body. And we're still learning about coagulation problems. There are still findings that we're not sure if they're COVID or not. And we know that unfortunately there are people who are experiencing long-term symptoms. And now that we're moving into the fall, we're also worried about flu. And so we have a lot of testing paradigms. We also have a new in-house flu test that we developed, knowing we're going to have to do a lot of testing in that space. And just to put it into context, what we've been talking about has really been testing for active infections. So doing the deep nose swab with the PCR, but also doing different types of samples. So our saliva test that we just developed. And you'll be hearing a lot about antigen tests that are out there. So Binax Now, for example, which kind of, when you look at it, it functions like a pregnancy test, but it tends to be much less sensitive. And so there are certain situations it's good for and certain situations it's not good for. As I mentioned, flu is out. And so now there's a whole paradigm as to how you test people. And again, what are we going to do down the road? And I think antibody tests will become more important. But there's a lot of questions about how long does it last? Is something like a T-cell assay better? And maybe it's good my picture is hiding the back part of this curve, but I guess I don't need to show it for you to realize that rates are going up in the state of Oregon, but there's a lot we could do to make a difference. Testing's part of it, but not all of it. Prevention measures, restricting contacts, tracing, all of that's really important. And so part of our goal by getting out in the community and testing is to try to bend that curve down. Next steps that are coming, there's an array of vaccines that are out there. We just had a call with OHSU today talking about distribution. And we could talk in detail a lot about these. I did want to point out here just this one graph that I took from this Nature paper that recently came out. This is a really actually good intro paper to vaccines for anyone who's interested. I just wanted to point out how many academic medical centers in North America are active in this space. And I think that's really important as we look forward to thinking about what we want to build at OHSU. And then this is my last slide. I could spend the whole time talking about this slide, but I won't, because I want to get out of this and tell you a little bit more about what I'm thinking we need to do to prevent some of these headlines in the future. But yeah, there's a lot going on. This is all stuff that's happening now. And, part of microbiology includes bed bugs, right? It's a parasite, mad cow disease. We just had a senior well-recognized pathologist in the US die from autopsies from doing mad cow disease. Mosquitoes with encephalitis, those mice in your attic. You have to be careful. They could carry hantavirus. So you probably shouldn't vacuum it. You should sweep it up with a broom. Gonorrhea, Zika. There's a new swine flu emerging right now out of China. And so there's a lot going on. And I just scratched the surface with that. And so, now that we've had that opportunity to kind of run through some of what we're doing, I just wanted to take the last few minutes to talk about the future and what we're thinking. So looking at that last slide, I'll tell you, to me, it really tells me that we haven't been able to keep ahead of many of these emerging diseases. And in fact, we're actually more just dealing with challenges as they arise. So it's almost more of a damage control mode. And I'll tell you, as a pathologist, we see this all the time. We're trying to rapidly develop diagnostics, test samples for antibiotic resistance, do genomics on viruses to see if they've mutated. And we also do autopsies on people who have died from infectious diseases. We're like, wow, we didn't know it could do that. And so with this recent experience at OHSU, I've really started thinking about how we can get ahead of all of this. And I think the first part is making sure that we have firmly established a diagnostic microbiology lab at OHSU. Through the donations I've told you about, we've already been able to build part of our microbiology lab, but we still need to deal and build out the parts that deal with bacteria and parasites and fungus. We've done pretty well building out the virus parts, but there's more to it than just that. And part of what we need to do is add more space, buy more equipment, hire more technical staff. But I think it's not just only about doing the routine diagnostic testing, but it's also thinking about innovative diagnostics and research. So I think about things as monitoring for potential virus threats as they emerge around the globe, and developing early testing kits that we can use in Oregon and then disseminate more broadly if needed as we see these viruses emerging. So I think rather than repeat what happened with COVID-19, where we waited for the CDC to develop and send out these test kits, we could have already used that virus sequence to publish and develop our own tests already back in 2019, had we had the lab that I'm envisioning. I think we can develop sequencing methods to track changes in the DNA and RNA of infectious pathogens to see how they're mutating or becoming resistant. And we can partner that with clinical trials and new therapy development. And part of this vision means bringing together research that already exists at OHSU and expanding research in areas where there are gaps. I think we can also learn about who's infected and how the immune system responds to infectious diseases differently in different people. So thinking about COVID-19, how does a person's DNA, their prior infectious disease history, comorbidities like diabetes, virus sequence they're infected with, type of immune response that they have, determine what treatment approach is best for this person? So it's almost like personalized immunology and virology. Can we figure out what will help individual people overcome these terrible diseases? And not just so that we do it here, but how can we share this information with other medical centers in the US and globally? And I think all of this is possible with the development of a future-facing cutting-edge microbiology lab in pathology that really has a mission of getting ahead of these disease outbreaks and disease resistance. So as part of this effort to build out a large, innovative diagnostic microbiology lab, members of my team and I have already applied for funding that aligns with this goal. Together with the Department of Chemical Physiology and Biochemistry, my department's been able to secure funding internally to recruit a leader in new fluorescent microscopic scale imaging who can help develop probes to measure how bacteria break down antibiotics in live bacteria in real time. So instead of waiting for that resistance culture to come back, you take the bacteria, put the probes on it, look at it under the scope, and you know within 30 minutes what you treat the person with. And that's where we need to go. I think, we really can be at the cutting edge of how we think about this. I'll share that we also recruited a director of microbiology, Dr. Xuan Chen, who's going to start with us in 2 weeks. We recruited her from the University of Washington, where she directed the microbiology lab at Seattle Children's Hospital. And she's already starting to build collaborations and plan out the next steps of the lab. We've also, I'll share, started programmatic discussions internally around where we feel we have gaps in areas outside of the clinical lab and how we can work together to fill these. So we're really talking about large-scale research programs and the bigger need to prepare for the future. But, I'll say, I think we do have a bigger mission to fulfill if we really want to get ahead of these infectious disease outbreaks and start to reduce burden of disease. And, we need to take all of these innovative research and diagnostic work efforts that we want to build at OHSU and, not just be a place that develops diagnostics and does research, but takes that knowledge and takes that ability to test and gets it out to where it's needed. And so I think that means a few different things. I think, part of this is taking what we learn into our local Oregon communities to provide education, testing, and treatment. But I also think it means reaching out beyond Oregon to build coalitions and partnerships to monitor trends and emerging pathogens and get ready in case they start to spread. So I know we don't have a lot of time today to talk about all the details, but I did want to share some ideas that I had about how you could build a program around a really cutting edge diagnostic microbiology lab. So similar to what I talked about, that we did with SCI, I think we can partner more with our local community groups in Oregon to understand where there are gaps in healthcare and begin to address those. We know that the body and underlying diseases in the body affect your ability to fight infection. So how can we continue to improve the health of Oregonians to limit the impact as these new diseases emerge? And I'll tell you, every community is different and access to healthcare is different. And part of this touches on social justice. And as part of this latter piece, in pathology, we've established a new Vice Chair of Health Law and Patient Advocacy position to really focus on this aspect. And Dr. Ken Gatter, who's an MD-JD in my department, he's founded recently the Medical Legal Partnership of Oregon to help people overcome legal barriers that prevent access to healthcare. I'll say, I think we also need to continue to work with the state legislature to raise awareness of community-based challenges that we encounter as we build these programs. I mean, we're out there, we're doing testing right now for COVID, and we see a lot of things that can be improved. I'll say, also thinking about this larger program we can build around a diagnostic microbiology lab is a focus on childhood health in the state of Oregon. And, sure, vaccines are a part of that, but there's a lot of other interventions that we could do as well. And I think there's a lot we can learn about the developing immune system in children, why children do so well with COVID-19 relative to adults. I also think we can understand which infectious diseases affect children who undergo medical treatments in the hospital and be able to treat those quickly before children become more sick. And, part of this is also learning about our local environment, where people live, what are they exposed to, what's out here in Portland and in Oregon that maybe we should be thinking about that pathogen and how to tackle that as well. But unless we're out in the community, we won't know. And, I'll just conclude by saying, I think there's a lot of room to reach out beyond Oregon as well. And we talked a lot about the work in diagnostics and vaccine development. But I think there's a lot of room for academic medical centers to come together and work together. But I'll tell you, there's been limited funding to organize groups into a coalition to share information and tackle the next pandemic. OHSU has started working as a part of a group of centers in the Pacific Rim to do just this. But is there a way to more formally build these and organize and fund these efforts? I think as we continue to see emerging diseases, that's a real problem. And, I think coalitions are also important to maintain pressure on the government to continue funding streams. So I'll tell you, after the threat from SARS and MERS diminished, federal funding to continue studying coronaviruses dried up. It wasn't a hot topic anymore. And so people who made cutting edge discoveries in this space said, there's no more funding, I'm gonna go study herpes virus. And can you imagine where we would be if that didn't happen, if we continued to have funding for people to keep doing research? So these are just some of the examples of some of the programs that I think we can build. And I'm really excited about this. And I'll say, if any of you are interested in learning more about this vision for the future, how you can get involved, please connect with Edgar and I. We're really excited about this. We're looking to really build our own coalition of advocates and supporters. And I think it's truly going to take all of us working together to realize this vision. OHSU has already made financial commitments to this and key investments, but we're going to need more philanthropic support to really achieve the margin of excellence that will really take us over the top. And I'll just say, I think once we integrate the infrastructure, the equipment, the people, our vision really, I think, has the potential to change the landscape in infectious diseases and save countless lives. And so I'd love it if you wanted to join us and help make this preferred reality, come true. And so with that, I know that we're close to time, but as I shared with Alan and Shelley, I'm happy to stay as long as you like and answer questions. I know we covered a lot. We covered about past history. We talked about COVID-19. We've talked about emerging viruses. And we've talked about how I think we can overcome this and be more forward-facing, as we continue to build our program. But with that, I wanted to thank you all. It was really a pleasure being here tonight.
Thank you so much, Dr. Hansel. There's a couple of questions in the chat that I will lob at you. The first one is, it's clear that additional funding would be beneficial, and you mentioned philanthropy from individuals and others, but what is the most likely source of such funding? You mentioned some grants as well. Can you talk a little bit about what grants can and can't fund versus what philanthropy can fund?
Yeah, that's a great question. There's some pretty limited grants out there from the federal government that can help build some of the infrastructure. So we've been looking at that to build out the hard laboratory space and have been working to apply for those. There's probably a lot more grant funding out there that continues to foster some of the basic sciences in infectious diseases and the development of clinical trials. And so this is where, once the infrastructure is built, then you can leverage that infrastructure to then have your researchers go and apply for these grants. So, moving forward, there's a funding in the sciences that can help. But as I mentioned, I think, where philanthropy can help is helping fund some of the organizational components, helping fund some of the collaborative initiatives with the community. For SEI, everything we're doing in Northeast Portland, isn't funded by people's insurance, because many people don't have insurance there. It's funded by philanthropy. So I really view some of the community-based initiatives as being a prime example of where philanthropy can make a difference. Infrastructure, the sciences, that's where there's grant funding that we can apply for.
Wonderful, thank you. You said a couple of things that were terrifying, of course, like all of the other pandemics that may come. And I really, as I said in the opening, we're so thrilled that you are here and you are driving this preferred future of being able to prevent and be much more prepared. But if infectious diseases will indeed, projected to kill more people than cancer in the future, what does this microlab provide OHSU in terms of evolving into a leader in a community? You talked a little bit about that, but who else is doing this, and how? You talked about a coalition. So who do we partner with, and how does OHSU become and evolve into this global leader and collaborator in infectious disease to prevent these deaths?
Yeah, so that's a great question. I think that there's a lot more room for academic medical centers in this space to work together, rather than simply being out there competing for the same slice of pie. And that's kind of where we are now, in part because funding's been limited, and everyone tries to get the same pot of money to build their program. But I do think if we can rise above that and really start to work collaboratively, both within the US as well as some of our partners. I mentioned Pacific Rim. We do a lot of work in Thailand, actually, as well as China and some of the other areas, where, through these partnerships, we're really aware of what's happening, before the media gets a hold of it. Because I think sometimes things get skewed and it's hard to know what's going on, but it's the personal connections and the collaborations that really give you insight into what's happening. And then you can get viral sequences ahead of time. You can know if something's emerging in another country you have to be aware of. And then working together, academic medical centers could each leverage their own strengths. You don't have to duplicate the wheel to do it. And that's where it becomes powerful, because you become an independent voice as academic medical centers to share your knowledge and share your thoughts. And I think seeing what's happened, just even at the beginning with the rollout of testing by the CDC, imagine if we had a group of centers that were ready to go. I think it could have really reduced the burden of disease early on. And I'll say, having this sort of coalition is also powerful as we talk to pharmaceutical industries and companies making, vaccines, because, we need partnerships with them. And sometimes it's all about commercialization and profit. And I think that there's a lot, and I hope no one on the call is from the pharmaceutical industry. I love you guys. But yeah, I just think, that there's a lot that can be done together. And right now we're not doing that. We're all working and out for ourselves.
Great. It's a big gap that we need to fill. Yes. I know everybody's thinking this because we've seen the news recently, and the stock market seems to be quite dependent on it. But there's Moderna and Pfizer and vaccines. And can you tell us a little bit in your expertise about when we can expect in real life to have a vaccine that we might be able to go and get at OHSU? Yeah,
so as I mentioned this, I think over the past hour, but we're at OHSU spearheading 2 of the vaccine trials, the phase 3 clinical trials. AstraZeneca and Janssen are here. And I know that there's been early release of results from Moderna and Pfizer. And, it's interesting because I think, the public is just learning about all the different types of vaccines. So the 2 vaccines that you've heard about in the news are RNA vaccines, and we can send the slides around too if you're interested, but that reference from the Nature paper is really easy. It boils it down to a simplified form to understand these vaccines. But the two that are coming out now are RNA viruses. And it sounds like they're going to be ready mid to late December, which is, I think, about when they're going to start rolling out in the state. That being said, the last thing you want to do is have a free-for-all, right? You really want to make sure that the people who need it most get it. And so there's been a lot of talk about who should be getting it. And so some of the talk is around frontline healthcare workers who are in the hospital. So you could get a vaccine and be able to help treat patients. So we don't end up like some of the countries, like Belgium, where people who are, infected with COVID are going in to treat people who are infected with COVID. So to really get the healthcare workers ahead of this, to provide better care and more continuous care, and then vulnerable populations. So, we talk about nursing home, people of a certain age, people with comorbidities, and what would that look like? And there's been a lot of talk about, a spoken wheel type distribution model with the RNA viruses. From a laboratory perspective, we know RNA is pretty tricky, and you need very special freezers to keep this. And if you take it out for 30 minutes, you're in trouble because the vaccine or the RNA is going to break down. And so I anticipate we'll probably have some supply issues around -80 freezers coming up in the supply chain too. But there's a lot of logistics that people just haven't thought about. The RNA vaccines are new. Having to have vaccines at really cold temperatures is new. Having all these different vaccines coming out all at once is really new. And not even knowing, because it's been so fast, we have no idea how long that immunity lasts. And we're hoping that it activates enough of the immune system, including the T cell piece, which is a complement to the antibodies, that immunity will last longer. But we don't know if it's going to last forever. So it could be like the other seasonal coronaviruses that cause the common cold, where, yeah, you get it 1 year, you're okay, and then the next year you get infected again. And so people are watching what's going to be happening to people's immune response and whether or not they get reinfected down the road following vaccines. We do know that people can be reinfected. We think the immune response to vaccines will be stronger than if you're just infected with the virus. But concurrent with this, we're also looking at mutations happening. Denmark just killed off all of their mink population because there was a big mutation that happened in the part of the virus that the vaccines were made against. And so, these viruses are tricky. And, the goal is the first ones start rolling out late next month. And then it'll be a 3-phase distribution where frontline, extremely vulnerable populations are first, then the next set of people who are more at risk. And then, the third phase is people who are healthier, maybe younger, who don't meet those first 2 phases. But I anticipate that we're going to learn a lot. Again, we're going to be back in this real-time situation where we're all hearing about it together and then making decisions and doing an emergency phone call at night saying, oh, what are we going to do with the vaccines? So, but yeah, start looking for more information to roll out very soon, I think, from the state. And, and it's going to be a phased approach. So every month, more and more will roll out.
Thank you. And I know that I think we were supposed to end at 7, and Dr. Hansel has graciously agreed to stick around, but I want to be mindful of everybody's time. So please, if you have questions, add them to the chat. There's one more in the chat. It's this: with global warming, is our scientific community anticipating an increase in dangerous pathogens migrating to more of the globe, and even the release of long dormant pathogens of unknown severity that are maybe released from permafrost or migrating wildlife and things like that? Are you guys focused on that, thinking about that? What's going on?
Yeah, that's a really terrific question. Part of the program that I've thought about, when we talk about local environments, is also thinking about ecological sciences. And, also thinking about what's in our water supply and how that's changing, and the reservoirs, how the air quality is changing, are even infected species switching, a bit where they live, right? So are bat migration patterns changing? So all of this ties in. There's been data already published, that does indeed show that the warming temperatures and the disruption of the normal pattern of, how our climate behaves is starting to shift. Bacteria, viruses. One of the images I had up even talked about the toxic algae blooms that we're seeing. I grew up in Florida, so seeing the red tide of these toxic blooms, is really sad, because we just didn't have them that often down there. And that's going to have ramifications to other species who depend on that, what they adapt to, what pathogens they carry. And so it really is a big snowball effect. And part of this too is, in addition to global warming, just development of natural spaces and close proximity with a lot of these species that, historically we haven't really been in such close contact with. And it's those two things together that we are starting to see an emergence faster and faster of new viruses, bacteria that's changing, algae is changing, and, the warming temperatures will only make it worse. I guess I shouldn't be so pessimistic. I think we could get ahead of this, but I think we need to be serious about getting ahead of this and building a program that's really looking towards the future, not just saying, oh, gee, there's a new swine flu, let's try to figure out how to address it. Like we need to be further ahead on this.
Thank you. I don't see any other questions in the chat. So Alan, I think I'll turn it back to you. I have added my email address to the chat in case anybody wants to follow up. Please, by all means, reach out. As Dr. Hansel said, we're grateful for the invitation and to have the opportunity to connect with you. Hopefully by this time next year, we'll be able to do it in person and have vaccines or have this a little bit more under control. But in the meantime, we are laser focused, and Dr. Hansel and her team are laser focused on making sure that we can stay safe and we can stay optimistic about what's to come. And I think that if we can achieve our vision and raise some dollars to get there, we'll be able to have a really robust and world-class operation out of OHSU, partnering with all of our colleagues across the West Coast. So thank you very much, Alan. Back to you.
Yeah, thank you. Dr. Hansel, Edgar, thank you for your time. It is not lost on us that it is now 7:12 in the evening, and you have graciously donated your time to us to educate us and help us understand better what's going on, not only here in Portland, but around the world. It's affecting us all. And from me to you on behalf of the club, thanks for the work that you're doing. I think it's easy sometimes for us to forget all the great things that are going on at OHSU. I started with that, so I'll end with that. You guys are, just up the hill from us, and it's really wonderful, everything that you're doing in this community and for the world. So thank you. Please, we would love to see you here sometime. So once we get through all this, whenever that might be, please consider yourself invited as my guest, our guest, etc., to come and join us for just some good conversation, dinner, a drink, what have you. So thanks everyone from the University Club that joined us, and have a great evening. We'll see you soon.
Thank you so much. Have a good night.
Thank you.
Bye-bye. Thank you.